Thank you, Kelly. And I'm very delighted to be with you to discuss this important partnership between the U.S. Conference of Mayors and the Bloomberg Philanthropies on this enormous challenge facing our country, facing local leaders like the ones that we're here to talk to right now about what this means. So let me start with you, Mayor Whaley, and in your role as Vice President of the U.S. Conference of Mayors, tell us a little bit first about what the situation is in your city. How much understanding, fear is there about this vaccine, and how do you plan to tackle it?
Well, first, I think the key is we have to be the carriers of transparency. People are going to have a lot of questions. We have to work to make sure that we get their answers, make sure they're honest, and deliver those to the people in the community that can share them with many, many others. I think what we're going to learn here through this vaccine is the best validator is going to be friends and neighbors. And so that's why it has to be on the ground, and why mayors and local leaders are so key in this. Secondly, I think it's our job to make sure that the vaccine is dispersed in a fair manner, right? In the testing part, when we were all pretty wild at the beginning of COVID, places like Dayton didn't receive the testing as quickly as bigger cities did. And so making sure that our communities have equal access, both communities that maybe don't have a pharmacy right in their neighborhood, but also the community as a whole. And those are the things I think that are on the top of mind for mayors across the country.
And Dr. Cruz, as you think about not just Dayton, but so many other cities across the country with populations who may understand the significance of COVID, but aren't sure whether to trust this vaccine. What do you say to them? I mean, we heard Dr. Fauci say earlier that for a number, it's understandable that people wouldn't necessarily trust it. How do you go about changing that?
Yeah, so I think it certainly is understandable, as you underscored, and that Dr. Fauci underscored, that many communities, particularly communities of color and others that have been socially disadvantaged and socially marginalized for centuries in many cases, to have apprehension about trusting something that's new. And I think a lot of times in the healthcare and also research setting, that when we think about particularly communities of color and we think about trust or mistrust, we often think that this is something that is historical, something that is from years ago, from perhaps some very unfair and unjust research studies that have been conducted, such as the Tuskegee syphilis study as an example. But really there are present day examples that these communities can turn to, both in their own experiences and that of family members or friends that for them might have been experiences where they've sought healthcare, or they have had interactions with the healthcare setting that where they didn't feel like they were treated fairly. And so I think we, because in the healthcare setting and in many cases in the research setting, we have not demonstrated ourselves to be trustworthy, that we have quite a challenge ahead of us because trust is going to be so important in disseminating this vaccine. And so as Mayor Whaley touched on, I think it's going to be so key that we partner with trusted agents in these communities. We who sit in the ivory towers of healthcare or in academia should not think that we would necessarily be the ones that communities of color, for example, would necessarily trust, but we should be arming those individuals that they do trust with good information that they can then disseminate to these communities that we for sure want to make sure get vaccinated.
So, Mayor Whaley, how exactly do you do that? Give us some examples of how you convey that this is something that your residents can trust, that they can know. Clearly, if they're going to watch a former president, which, we've heard President Bush, President Obama say they're going to get their vaccine in public. Is it enough to see people who are well-known having taking the vaccine? What is it going to take? What specifically do you think about that you need to do?
Well, certainly these national leaders are key. So I think that is a great step, and I think Dr. Fauci is a trusted voice on this across all of our communities. So that's a good step. But we're doing things already. For example, at the beginning of COVID, every Friday morning, at 8:30, I have a clergy call with clergy all across the region, really to try to message about, hey, we really probably shouldn't have services. Let's do things outside all through COVID. And last Friday, public health doctor was on and said, give me every single question you have about the vaccine. And so for 25 minutes, the clergy gave their questions. And so the answers that public health had right there, they answered and said, we're going to get back to you on these answers. I think that's really important, that we have to have leaders on the ground in the community that say, I checked this out. I asked the questions of the doctors. I'm getting the test too. And I think that will make a very big difference on the trust level, because those are the folks like, oh, if my priest or my rabbi or my pastor is doing it, I feel comfortable doing it too. And particularly because we are really concerned about the most vulnerable in our population, which are folks that really do pay attention to that leadership group. So I think those are the ways that we can really make a great difference. And I know mayors across the country are doing that right now every single day.
And Dr. Cruz, pick up on that. I mean, what are the voices, the individuals that people can trust? And also speak about where the vaccine's being offered. I mean, are they expected to go to a neighborhood clinic? I mean, how much does the location matter, do you think?
Yeah, so I'll start with the latter part of your question first. I think it's certainly going to vary by locale, and in some cities it will be community centers, health departments, some local pharmacies are also planning to disseminate the vaccine. I think that as we try to make sure we disseminate it to the most vulnerable communities, we really do need to take a real consideration of where we are going to be afforded the greatest opportunity to reach the largest number of those individuals and position the vaccine dissemination in those places. There are, as Mayor Whaley touched on, there are a number of religious leaders who are saying that they will not only take the vaccine in a public way so that their members can see it, but that they would also be willing to offer it in their churches, their synagogues, and other houses of worship. And so I think taking the vaccine to the places where these most vulnerable members of our community at large is going to be the best way to make sure we disseminate it properly.
I was also going to say, I think, this is the part that's, I think mayors are paying close attention to. I'm really happy that we're trying to normalize the distribution of the vaccine at CVS, just like we would or Walgreens, just like we would the flu shot. But we also have to remember that there are places in the community that do not have these pharmacies, that don't have grocery stores. And so making sure, particularly that the government takes the extra step to make sure that we can reach these hard to reach places is going to be important for cities like mine, but also in rural communities across the country. So that's something that we're really trying to make sure is in the local planning as well.
So Dr. Cruz, let me just finally ask you, what is the one message that you want our national and local leaders to get out to these communities at this point as we look at the weeks ahead?
So I think the one message is that an invitation really to partner in this important work that lies ahead. I think for too long, for many of these types of efforts, a lot of the work has been done separate from these communities that we've talked about today. And I think that there should be an open invitation, a frequent invitation to work together to find the best ways to disseminate this vaccine. And that's what I hope will be happening in the months to come.
Well, I know both of you have your work cut out for you, Mayor Whaley, and so many other mayors. And I know experts like you, Dr. Cruz, they're going to be calling on you as well. Thank you both so much, Dr. Deidra Cruz and Mayor Nan Whaley of Dayton, Ohio. Thank you so much.